First to you, Dr. Esther Mariaselvam. What exactly are you looking at? Is this worrying? Is this scary for what you are seeing?
Yeah, definitely. This kind of ecological damage that's been happening in the recent past, and the kind of disaster, the frequency of the disaster and the intensity of the disaster, it really impacts the excluded and marginalized community. In that manner, like if you see this impact of the oil spill, particularly the fisher folks are the worst affected because they are actually their lives and livelihood are dependent on the coast and sea. They are living very close to the coastal areas. And therefore, when this incident has occurred, and in fact, like the oil spill water, when it got into the houses of some of the families which has been residing along the coast, it's all the more worrisome. And in fact, these fisher folks have lost their livelihood for almost so many days since the beginning of this month. And their livelihood is totally dependent. And it causes a great concern for these fisher folks because now, like particularly among the fisher folks, the fisher women, those who are vending fish in the market. In fact, in the recent past, after this incident has occurred, when they went to the market to sell the fishes, and there is no take for the fishes that they have brought in. So it is a great concern for them. And the fisher folks, for them, their boats and nets, which they are so much dependent for their livelihood, because of the oil spill on their boats and the nets, their worry is like how they will be able to use them for the future livelihood options. And also the way the people from the fishing community themselves who have been engaged in removing this oil, that is also a major concern. Initially, without providing adequate protective equipments, they have been engaged in this process. It causes a great concern for their health issues also. The government has been taking proactive steps in terms of organizing health camps and things like that. However, it requires to be more in numbers so that all people and all the necessary health access that would be required at this point of time, that may be provided to the people, and their concern regarding the health hazards that it would cause, that would be actually taken care. And the fisher folks' livelihood, whose boats and nets are damaged, they should be adequately compromised.